The coarse-grained plaque is a plaque type that I observed in my first study when I looked into the neuroinflammation in typical and atypical Alzheimer's disease. So it was in a small cohort of patients with a young onset of the disease. So that means before the age of 65. And those patients also all had an atypical distribution of tangles. So there were more tangles in the parietal cortex. And then looking at the neuroinflammation, for example, complement factors, I saw these big plaques that I didn't see in patients with late onset and more typical memory presentation during life. And we looked into the literature, but we couldn't find description of these plaques. So we characterized them with looking into all sorts of proteins that are in these plaques. And we compared them to the more common or well-described plaques in literature, and also to what we call cerebral amyloid angiopathy. In this case, the amyloid-beta is deposited in the blood vessels of the brain. And what we saw is that this coarse-grained plaque is biochemically different than typical common parenchymal plaques, and also different from this cerebral vascular amyloid. So it's a plaque because we find it in the brain parenchyma, but it consists more of amyloid-beta 40 rather than amyloid-beta 42. And that's opposite from typical plaques, but very similar to what we see for CAA. And it also consists of a protein, what we call norin, that's been found to be specific for CAA. Another thing that I think that is important is that we looked into cases that do have amyloid-beta plaques in the brain, but don't have any cognitive complaints during life. And in those cases, I haven't observed a coarse-grained plaque, whereas those other plaques, classic cord plaques or diffuse plaques, you can find them for sure in people that have amyloid-beta but no cognitive complaints. Diffuse plaques or classic cord plaques or compact plaques are plaques that are all described in people that do have amyloid-beta in the brain, but don't experience cognitive complaints during life. Now, for the coarse-grained plaque, I've only observed it in cases that were described to have cognitive complaints during life. It was in a small cohort, so I definitely need to look into. More cases. So more what we call cases with Alzheimer's disease pathology, but without cognitive complaints. But I think it's definitely a very interesting finding. So I want to continue with the coarse-grained plaque. I want to continue looking into different types of patients. And I also want to see what proteins it consists of without a targeted approach, so using proteomics and comparing it to the other described plaques. I also want to see if there's maybe certain genotypes that are associated with this coarse-grained plaque. So we found it in young onset patients, and not all of those patients have what we have one gene that we know causes the disease. So for example, PSEN1 or APP. In some of those patients, you see coarse-grained plaques, but of those young onsets in which we can't pinpoint it to one gene, we see coarse-grained plaques. So I want to see if there's maybe a combination of genes that are associated to this plaque.